Let us learn about CPR. Now, before learning about CPR, we should know the difference between heart attack and cardiac arrest. Heart attack is when the heart gets blocked due to plaque, and cardiac arrest is when heart stops beating. CPR is performed in case of cardiac arrest. What is CPR? CPR stands for cardiopulmonary resuscitation. It is a life-saving emergency procedure that is performed when someone's breathing or heartbeat has stopped. It helps during cardiac arrest, that is when the heart stops beating and is unable to pump blood. In order to supply oxygen-rich blood to vital organs of the body, chest compressions are given to push the blood inside the heart to other parts of the body. When to give CPR? CPR should only be given when the patient is not breathing. CPR should not be performed if someone is unconscious but still breathing. So, if a person is breathing, CPR should not be given to them. A prerequisite before performing CPR: bring the patient to a safe place and place him on a hard surface where CPR can be performed. Ask someone nearby to call the ambulance and bring more people for help. The person giving CPR should not waste time in calling the ambulance, and rather someone else should call for the ambulance. Then check for the person giving the CPR should check for consciousness. If the person is conscious, then do not perform CPR. If the person is not conscious, then check for ABC. A stands for airways. See if the airway is blocked by food, tongue, or by vomit. If it is blocked, clear it before proceeding for CPR. B stands for breathing. See if the person is breathing. Check if the chest is rising or falling. Put a finger under the nose and try to feel for passage of air. C stands for circulation. Press the carotid artery under the neck on the side of the Adam's apple to check for pulse. Demonstration for checking the circulation is given in part 2 of this video. If breathing and circulation are not felt, then proceed for CPR. Before giving CPR, make sure the person is placed on a hard surface, otherwise CPR will not be effective. Now, what should be the duration of CPR? Perform CPR till medical help arrives. That is why from the starting, someone should call the ambulance and other people should be present around so that someone else can take over when the one performing the CPR is tired. Now, let us see some more points regarding CPR.
This is the head. This is the heart. This is the chest wall. And this is vertebra, means bone. This is the chest rib. And this is the vertebra. Vertebra means spinal cord inside. So what will, if you press, this heart will go and strike behind the vertebra. This is a hard surface. If the floor is not hard, again it will go by spongy, the purpose will not be solved. So first of the principle is that the heart, wherever you make it, if it is in a bed, bed is not a hard bed, it is a cushion bed, purpose will not be solved. You bring out from the floor and start. So when you press, this heart will come to the hard surface of the spine, and this is the hard bed, and this will press. So blood will flow in upper direction. So what much compression will give? This is the compression from you are giving. This is the hard bed, and this blood, whatever is the blood is naturally squeezing and blood is going. This is the basic principle. Once the blood will go, it go to the brain, and here is the mouth. Through that, 30 is to 2. 30 compression into 2 mouth to mouth. This 30 is for heart. This 2 is for respiration. This will give oxygen. This is blood supply of blood. This is the purpose of 30 is to 1. I will treat because 30 into 60 into 4 average 72 to 80 of blood होता है. Then 5 to 6 respiration is sufficient enough to give oxygen. This is the basic purpose of this. And second thing, how much compression? Is it tell that if you are able to fracture a rib That is also good. Less compression will not do. It will give a more compression. Let me one or two rib fracture, no problem. But life will survive. But simple compression has no meaning at all. So that is the how much deep you will give?
2 inches and 5
2 inches. One finger is thicker 1.5 centimeter. Almost 3 to 4 finger deep you have to go. So if you press, that is the basic principle. Heart is a, chest is a empty organ. This chest cavity is a empty organ. Heart is here and vertebra is here. Rib is here. Front to view. So if you may give a compression, this chest will compress here. This will go and compress here, and it will even more. That is the purpose. So if you will give this much of compression, the purpose will not be served.